protecting healthcare workers from COVID-19 based medical hazards. On this particular topic, we have got speakers like Dr. Shubhendu Sarkar from BM Birla Hospital and Research Center. He is a senior consultant and in charge of OR and ICU. Followed by his presentation, there will be a presentation from Mr. Santosh Verma. He is our service head for all three verticals modality in Mindray India: PMLS, ultrasound, imaging system, and IVD. And thereafter, there will be a presentation on what to do, what we don't need to do, do and don't, from Mr. Rajesh Gupta. After Dr. Shubhendu Sarkar presentations, we'll have question answer session for Dr. Sarkar's presentation. And thereafter, after a couple of presentations from Mr. Santosh Verma and Mr. Rajesh Gupta, we'll have a combined question answer session together. And we'll close the session by 6:30. This is the overall agenda of the event. And I'll just hand it over this session to Dr. Shubhendu Sarkar. Sir, you can start your session. You can share your presentation, sir. All yours. Thank you.
Good evening to all of you. I think, am I audible more or less clearly?
Yes, sir, you are audible, sir.
Yeah, fine. Okay, so very good evening, good afternoon, whatever you say, to all of you. And today the topic, what actually attracted me is the protecting the unsung warriors. The COVID-19 is a situation from the month of, at least in India, from the month of February onwards, we're actually facing an enemy whom we cannot see, whom we cannot delineate, whom we cannot identify what is actually shape, size, what is going to be, and we are trying to fight against. And the most important thing is every day you are finding some of the new developments. You will be able to see some of the new hypotheses, some of the new theories, some of the new treatment recommendations, some protocol and everything. And we got a very small amount of time to reshape ourselves, rather to rejuvenate ourselves to fight against the existing situation. And among them, if you look carefully, the situation is gradually affecting the healthcare workers, whom we actually call the unsung warriors. And this topic has been actually projected towards them, and as because I came to know that there are a couple of our paramedical friends are sitting and they are planning to join in the session. So definitely I tried my level best to make this presentation as basic as possible so that we can have an open discussion after my presentation is over. The time has been given to me is 25 minutes. I'll request Santosh, who is actually coordinating the session. Santosh just gave me a reminder at the end of 25 because probably I will be able to finish in 25. I'll stop then and there. And if the rest of the time we'll try to utilize for a question answer and the both way discussion. Rather, because this is more important, rather finishing my lecture and completing my all the slides. Okay. So, sorry, Santosh, I couldn't incorporate the slides. The slides, it has been already prepared beforehand. My sincere thanks to Mr. Santosh Kumar Verma, Mr. Rajesh Gupta, and definitely Santosh, a very old friend of mine from the days of Edward Life Sciences. And thanks for taking the initiative and getting it done, because we all know, we have seen after curtains that there is a pandemic of COVID and there is an endemic of webinar. So in these situations, obviously, a webinar of this type of topics projecting towards the healthcare professionals is really appreciable. So with my deep regards to the entire Mindray team and the organizers, I am proceeding with my presentation. Today's agenda. The today's agenda is we want to know few words about Corona. not the old story and other, but we want to know the basics of the thing, because whenever I interact with a clinician or the paramedical staffs, what I came to know, people knows a lot. If you ask them, they can show you a mobile or the laptop, the hail of the information juggling with this in this small amount period of time. But the most important thing is the crux of the story, the proper protocol and proper inside outside equilibrium business of the situation understanding is the most important. So where we are today, the unsung warriors, the suggestive lifestyle, taking care of our heroes, and the some frequently asking questions. Probably I'll be able to give some of the answers. What is the frequently I am facing with my paramedics and the medical staffs. A recent discharging criteria. This is the discharging criteria published by our West Bengal government as well as the Central Health Ministry yesterday evening, and we'll conclude. Santosh, again, I'm trying you. I already wasted probably 4-5 minutes of time, so I have only 20-25 minutes left. So at the end of 25 to 30 minutes, please give a reminder. I'll stop then and there.
Sure, sir.
So few words about the corona. Nokia is connecting people. So corona is actually the disconnecting people. So let's start with some light mood. Actually, we forget what is Sunday, what is Saturday and other. But I want to remind you today is Saturday evening. And 3 months before, the Saturday evening was totally different. So, so this is the way how it changes. So a few words about the family. And please remember, it is nothing new. It's an old one. It was actually started with the Middle East respiratory syndrome, and then it changes its mutant things in a new form and phase. It again reappeared in the China, in the Wuhan state. And the most recently discovered coronavirus is the infectious disease caused by mostly recent by the, that is the diagnosed coronavirus in the Wuhan, China in the December 2019. Official name has been announced for the virus responsible for previously known, which is actually the name of the virus was previously 2019 novel coronavirus. Now it has been changed, and for your information, the COVID-19 is the name of the disease, not the name of the organism. The name of the organism is severe acute respiratory syndrome coronavirus 2, that is a SARS-2 coronavirus. So we say COVID, COVID. COVID is not a COVID, is the disease. Okay, and the SARS-1 is the name of the virus. Santosh, just unmute yourself. I just want to take this bar off because it is actually occupying a part of my slide. So I think, yeah, fine. This is the best thing I can do.
We are still on the first introduction phase of your name.
Okay, okay, very good. Fine. So on in the next slide, on the left side of your screen, you can see these are the list of the symptoms a patient can come to you with the coronavirus infection. Starting from the fever to hell of the thing, starting from
Sir,
the
sorry for interruption, sir. Your slide is not moving, sir.
Yes. Not moving?
No, we are in the first slide, sir.
But here it is moving. You are still in the first slide.
Yes,
sir. Can you do a stop sharing and again start sharing?
Yes, yes, yes.
Okay. Stop sharing.
And start sharing.
Yeah, started.
Yes.
Now this is the first slide.
Next page.
Okay.
Yeah.
Yes.
Yeah,
now it is moving.
Can we see the next slide?
Yes.
You can see the next slide?
Yes. Yes.
Oh, so till now I already escaped 6 slides. Okay. So this was my second slide. Okay. Santosh, deduct my 4 minutes. Okay. This is my second slide initiative. This is the 2 days agenda. We want to say the few words about the corona. We are actually in this first point. Then we'll go to the where we are today, unsung warriors, then suggestive lifestyle, taking care of our heroes and the frequently asking questions, and a recent discharge criteria. This discharge criteria has been published by the Ministry of Health Welfare yesterday evening, and conclusion. Are you being able to see the slides?
Yes, sir.
Okay, fine. So the next slide is the few words. So this is a slide which actually tells the Nokia connecting people and the Corona is disconnecting people. So we know the pain of the disconnections we are facing, and probably we forget that today is Saturday evening. Anyway, we need to enjoy the Saturday evening. So this is the slide actually where I was. The coronavirus is actually nothing. I just want to summarize in 2-3 lines. It was actually started in the Middle East Respiratory Syndrome. And the new coronavirus, what has come is the disease that is the COVID-19. And this COVID-19 is an infectious disease caused by the most recently discovered coronavirus. In the December 2019 China, I really forgot. I came back from China National Conference in November. Okay. Officially responsible for the COVID-19, previously known as the 2019 novel coronavirus. And 2 points I want to make you absolutely clear: this COVID-19 is the name of the disease, not the name of the virus. The name of the virus is the next line, SARS, that is a severe acute respiratory syndrome, CoV coronavirus 2. SARS-CoV-2 is the name of the virus, and the name of the disease is the COVID-19. Okay. How it is come, that's how the name of the COVID-19 came. This is a slide where you can see on the left side of yours the list of the symptoms, starting from the fever to the pink eyes. These are the different varieties of the presentations of the that can come with coronavirus infection, starting from the fever to the pink eyes in a different way. But the most unfortunate thing that we are getting couple of numbers of the patients who are absolutely asymptomatic, and unfortunately we are getting them COVID positive. That is the real threat right now we are standing on. And the corona COVID 2019 acute respiratory disease, novel corona, Wuhan pneumonia, there are the different names and other. You can give another few names also by yourself. Okay, now the spectrum of the severity. If a disease comes, it actually comes in the form of a mild, which is really actual 81% of the cases. It usually comes in a very milder form. It comes to a severe disease, 14% with some respiratory discomfort where you need a oxygen therapy. The patient went to the happy hypoxia zone. And the critical disease where you need to go for a hospitalization, patient need to be ventilated, and the patient can encounter a different organ system dysfunction. The last 4 lines is extremely important. The cardiovascular disease, diabetes mellitus, chronic lung disease, hypertension, malignancies are increased risk of mortality in COVID individuals. This is an Indian Medical Council, that is the ICMR, Department of the Health and Research. It has been published in 9/4/2020, 9th of April. You can see the word written version 4. That is, it is the 4th time of modifications they have made for the strategy of the COVID-19 testing in India. Right now, we are following these criteria for testing of the COVID, if you are suspecting anyone. The point number 1, if you have a history of the international travel history in last 14 days. Number 2, all symptomatic contacts of the laboratory confirmed case, all symptomatic healthcare workers, all patients with severe acute respiratory illness, and asymptomatic direct and the high risk contacts of a confirmed case. And if the patient or the group of people come from the high risk zone, that is the hot spot or the cluster zone, you need to directly go for an antibody test if it is after 7 days, and you can go directly for the RT-PCR test for if the patient comes within the 7 days of the illness. You have been able to see the slides, no?
Yes, sir.
Okay, fine. Okay, so this is a slide. This is a slide where it says that rapid antibody-based blood test, how is going to help us. If you just follow the column, the extreme left-sided column, if the patient is having IgG and M both are negative, it indicates the patient never had a virus. If only the IgG is only positive, you can see this is I am showing the cursor. If it is IgG only positive, it indicates the patient was asymptomatic carrier and can have a clinical case, but chances are very less. But the patient gradually develop the immunity. But if you find IgG and IgM both positive, it is again asymptomatic carrier, but the clinical case conversion chances are very less. If only IgM is positive, it can end up to a severe infective case. And following this slide, if you follow this one, these are the different types: nasopharyngeal swab, virus isolation from the respiratory tract, bronchoalveolar, stool PCR, IgG, IgM antibody. If you follow all these curves ups and down, you'll be able to see if the patient is having an onset of symptoms here 1 week before and 1 week after. This is the area where the maximum positive result comes. So that's why we are very much concerned about this within and the after 7 days of developing symptoms, what test you are going to advocate of that particular individual. Okay. I feel that my first portion is over. I think we know not to need much about the coronavirus. So you know what is coronavirus, its nomenclature, its features, and validity of different type of the test, and particularly when and what tests to be done. Now, a few bad slides about where we are today. This is a slide has been taken. This is 9th of May at 8 o'clock in the morning. This is updation in the Ministry of the Health and Family Welfare. We have 39,834 active cases right now in India. It is the latest updation, today's morning statistics, what I'm presenting in front of you. And this is by the ICMR. It is again published in the today's at 9 o'clock in the morning. There is about 15,23,213 sample has been tested till 9th of May at 9 o'clock in the morning. And these are the consecutive 3 slides is going to be very important to understand. If you see the zone, if you see these are the bar of that shows what are the number of the cases. And you can understand the Maharashtra having the maximum densation. And this is the number of the positive cases. This is the distribution of the positive cases all over India. And this is the state statistics. If we go to the cured case statistics, the curing is also, you can see the, if you see the distribution of the curing, Maharashtra is also doing very good job regarding the curing is concerned. Simultaneously, they are having so much number of cases. And also you are having the other different states that the Gujarat, you can see the Punjab and all these places, the curing rates is quite high rather than in comparison to West Bengal where we are sitting right now. If we go to the next slide, this is the death. And you can see that suddenly the color change death in West Bengal. And this is on your right side, you can be able to see what is the current status right now till 9 o'clock in the morning today. This is the status, health status of the active case, cured, and the death. You can see the death is also increasing. The cured case is also increasing. That's a very good news for us. But simultaneously, there is a real jump of the active cases in the community in West Bengal. So we are actually sitting on fire. There is no doubt about it. You can explain in a different way. You can make thousands of the hypotheses and other. We are fighting against a blind enemy. Our eye is totally closed and other. Just like a Dhritarashtra, we are trying to see the Kurukshetra war. We are trying our level best to see everything. And we are just beating around the bush or something. But the one thing we have to keep it in our mind, there are few formulation that has been already well established. These are the things we are going to discuss today. And we need to follow strictly because we cannot ignore this card demonstration till 9 o'clock to the morning. It is not expected. Right now at 5:45 in the evening, the car will come down suddenly like this. It can never happen. So it is increasing. Our active cases, our death rate, everything is increasing and we have to accept the fact. And from this fact, we need to find out some armamentarium to encounter what is the current situations in India to fight against the COVID-19. This is the same slide, the West Bengal, the death and the, as well as you can see in comparison to the 1678, almost 160 people has died. So my second portion is over. Now come my third portion, unsung warriors. You can remember the slide, the unsung warriors. Our famous field, but actually, I liked today's topic. I told you in the initial phase that this is a CME or that this is a webinar rather, addressing towards the safety, thinking about what we are thinking about us, what we are thinking about our friends and colleagues who are working day and night, hands on hands together to fight against the disease. So the real list of the unsung warriors are there, starting from the nursing staff, medical nursing student, phlebotomy, respiratory therapist, pharmacist, admin staff, social worker, ambulance driver, ward clerk, bronchoscopy, OT staff, dietitian. The last one is doctors. We know definitely. The last one is the doctors because we know what are the things to be taken care of. But the most important, the time has come after assessing and analyzing every statistics and every bit of the progress of the disease. The most important and the most vulnerable important thing is we need to take care of our unsung warriors who are working together. Okay, so go to the next slide. Can you identify this one? Santosh, can you identify the person?
No, sir.
Dr. Shubhendu Sakar. Okay, so this is a photograph taken yesterday in our operation theater. You can see how Corona changed everything of ours that we even cannot identify ourselves. That's why I asked. So next portion is called the suggestive lifestyle. What Corona has suggested us. Santosh, I am expecting some of the suggestions of the answers about this suggestive lifestyle from any of the participants. They want to participate, or should I proceed?
Sir, proceed, sir. And 5 minutes.
That what Corona taught them till now. What Corona? Because I'll finish with the questions and the answers simultaneously together. So what Corona taught us in last 3 months? 3 months. What to do, what not to do. Okay, I think I should progress.
Yes, sir.
The suggestive lifestyle, how long does coronavirus survive on surface? Any answer?
Sir, it depends on location, whether it is on plastic or. Better you can respond it back, sir, from your expertise.
Fine. Yeah. So if you see this slide, you can see the plastic for 5 days, aluminium for 2 to 8 hours, surgical gloves 8 hours, steel 48 hours, wood 4 days, glass 4 days, paper 4 to 5 days. So we are surrounded by all these things in your house, outside, everywhere. And this is the spread of the coronavirus. So it's not only that you are avoiding a person, you're avoiding a suspected individual. It's also you need to take care of your surroundings. If it has been touched or it has been contaminated with any one of the positive patients, the virus stays for such a long. And this virus can easily transmit it to your hands or anything. Okay. So what are the things we can do? We can do, the first one is social distancing, obviously your choice. You can assume the 6 feet at any way you like. You can take the 6 feet as a horizontal. If you want, you can choose the 6 feet as a vertical. You can make your social distance. There are few pictures, do's and the don'ts. I think you will all agree. Do's and the don'ts. There are another few do's and the don'ts. Do, don'ts, do, don'ts. And Sambha in Sholay is practicing social distancing since 1975. Okay, so we had intelligent people. So we are actually doing research against coronavirus from long back. Okay. Can you describe the picture? What does it mean?
Sir, if we can break the chain.
Lockdown. Yes, we can break the chain. That's the lockdown. And that's why I put the caption, if you can't do outside, do inside. So everything you can do inside. Now probably we have got habituated. Okay, so my third portion is over. The fourth and the most important portion, that is the taking care of our heroes and some frequently asking questions.
Sir, we have
You need to read this slide very carefully. Guidelines for the healthcare professional: stop bringing your laptop and the handbags to the hospital. Don't carry wallet, money, or the wear watches to the hospital, just a credit card and some notes. Clean your spectacles, car, bike keys, mobile, or any other things you are carried to the hospital. Change into the hospital scrub and the uniform first thing on correctly. Don't throw it anywhere. Don't use phone, remote, iPad on the duty room. When you reach home, better to leave your mobile phone in your car or the two-wheeler, not carry it to the home. On reaching home, ask someone to open the door for you and move straight to take the shower. Don't waste your time in the dining space. Best to wash your clothes immediately or put for the wash separately. Those with the elder and the children at home, it's better to stay away from them for some time. Wash your hands regularly and keep sanitizing. This line is applicable for our healthcare professional and for everyone. So this is the generalized consensus you must start practicing. The indications of the hospital admission, I'm not going into the details. It is exclusively the clinical thing. In general, you should know if your patient start having a respiratory rate is more than 24 and the saturation comes down below 94 on the room air and the patient is confusion, drowsy and the BP is unstable, is better. You must get the patient admitted in the hospital and start giving proper therapy. This is a chart, flow chart by BM Birla, the CK Birla Health Group, what we are practicing. I'm just in a short way, I'm trying to describe. This is 2019 novel coronavirus protocol. The employee presenting with the fever and the respiratory symptom in the emergency department. Whether the person is stable, I'm again tell you, employee. That is our healthcare workers. The semi-stable patients, and we know the patient is positive, semi-stable, and satisfying the admission criteria. So these are the three: stable, fever clinic, isolation. Patient is semi-stable, examination in the isolation, admission, and the sample sent, sample positive as per protocol, sample negative to the ward. And you know, if the patient is positive, semi-stable, admission in isolation, protocol, and discharge after the patient is having negative report, and you are finding that a virological clearance of the two sample at least 24 hours apart. The next one, this same health employee or staff, if come with severe respiratory syndromes in the emergency and the patient is unstable, and we don't know the status, and we know it is a positive unstable. So if it is an unstable, immediately admission of the patient, send a sample, sample positive, protocol, sample negative, shifting to the generalized ICU or the ITU, and the patients, if needed, go for a ventilation. And the opposite side, you have to take the patients admitted in the isolation room and the treat as per protocol, and the discharge again the 24 hours apart, two report comes negative. This is an informed consent form patient undergoing treatment in our hospital in this COVID pandemic period, because couple of cases we are finding the patient parties has started accusing the clinicians and the hospital's administration about getting infected. Suppose the patient admitted and the patient did the test and suddenly it came positive. And the patient is accusing it because you in your hospital, everything is not properly protocolized, maintained. That's why patient got infected with COVID. So that's why we prepared an informed consent form, and that is applicable and to be filled up by the patient relative for any type of cardiological, cardiac, surgical, or any type of treatment procedure once the patient got admitted. This is a fantastic
1 minute to go.
chart. I don't know how much it is applicable for. Yes, Santosh, any problem?
1 minute to go, sir. We have a couple of questions also.
Yeah. How can I see the questions?
I'll say the question. I have received from YouTube and I have the question.
Okay, fine. So let me finish my presentations. I need another 15 minutes around or so. After 15 minutes, I'll stop and then I'll answer all the questions. Okay. Should I proceed?
Sir, your timeline is actually going to complete now.
Okay. So you just go on seeing the slide. I am showing this is how I practice of doing an intubation thing by covering the patient face. I'm rapidly showing some of the slides. This is our intubation and the extubation protocol. What are the things we need to be followed after the patient is planned for an elective ventilations? How to extubate, how to intubate, what are the drugs to be ready, how the airway trolley to be ready, how the ventilator to be ready, what are the filters to be attached, and what is the criteria, and what are the things we should not do. We should not practice if the patient is on ventilation. Okay. This is the PP, and these slides are extremely important whenever you are wearing a PP. This is the cycle, how to wear the PP. This is a 1, 2, 3, 4. You can see this is the sequence and the complete how to wear the PP. So you want to mention you that COVID has taught us some of the very protocolized thing. That is, there is no doubt about these protocols and other. But the most important thing is you need to practice this protocol in a proper way. If you break this cycle of wearing a PP, so all your effort gone. Okay, so this is the doffing, how to take off the PP. Again, you have to follow the numbers. This is the list of the aerosol generating procedures where you need to wear extra PP. Can PP be reused? I'll give the answer. These are the different masks, their efficiency, and these are the N95 respirators can be sterilized or not, and what are the way we are sterilizing the N95 mask. If you dry that N95 mask in a sunlight, whether you can use it or not. What you should not reuse, when you should not reuse the respirator. Can healthcare worker providing the clinical care use cloth mask, whether this cloth mask is actually applicable for or not? The protocol of the hand washing for 40 seconds. What are the protocol of keeping the fans in the isolation area? Example is for the lab technicians. This is a small video where how this lab technician is taking sample. So because of the time constraints, I'm just keeping the slide. These are the areas where you should discard your PP and biomedical waste, and how to handle the laundry. This is an asymptomatic health worker. Whenever come to a positive contact case, the test should be sent, and where the test to be sent, it should be sent in the day 5 and the day 14 of the coming to the contact. And these are the small photographs. You can easily identify the isolation, the telemedicine start. You can reduce the burden in your hospital and the patient party load so that your hospital become neat and clean and free from the gatherings and other. This is how the shifting management to be done for all our paramedical staff, because sometimes if you get a positive, a number of people has to go for a quarantine. And these are the different triad symbol to divert people whenever they come inside the hospital to avoid the gathering. Next, planned surgery recommendations. Chloroquine prophylaxis, you can ask me what we are practicing. I can tell you the actual story and the side effects. And don't let the coronavirus anxiety to take over. You need to start yoga. We already started this yoga therapy for our nurses, brothers, as well as the paramedical staff every day in session wise. So they should not be get disheartened or just mentally depressed. And regarding the relapse, it is absolutely the scientific basis answer. Yes, there is a chance of the relapse, but it depends upon a lot of criteria. And this is the revised discharge policy of the COVID cases. We need to divide the COVID cases, and according to the test result, we need to form the discharge criteria. So we know that we are fighting against the COVID, and please go through this. This is an extremely important slide by the AIMS New Delhi, published in 27th of March. The entire guideline of the management of the COVID-19 patient of 3 categories, mild, moderate, and severe. Whenever they come to the hospital, what are the pathway and which patient should go to the ICU, what are the therapies to be given, and how the patient should be taken care of in details it has been given. This is an extremely useful slide. So stay home and stay safe. And thanks for attending and listening. I think Santosh, I can attend few questions to give the answer. Thank you very much.
Right, sir. The first question is from Dr. Sanjay Gupta, Pathankot.
Yeah.
He's asking that how to sterilize anesthesia workstation after a COVID patient taken into OR after all the precautions. What is the ideal guideline from your end?
Yeah. So the most important thing is two things we are practicing. The first one is any emergency patients, we are accepting this patient as a COVID positive, because for an emergency, we don't have any chance to wait for a COVID report or not, right? And as because we are assuming these patients as a COVID positive patients, the first of all things we do the plastic cover of the entire anesthesia machine. Plastic cover of the entire anesthesia machine. We cover the entire monitor. You know, in a cardiac setup, we have a lot of high-end devices surrounding the patients, including the transesophageal echo, anesthesia machine. We have cardiac output monitor, everything surrounded. We have a tons of the syringe pumps and other. So these are all plastic covered, and we need to wear the PP. We need to manipulate those instruments. And when the patient is shifted, we do the high wall scrubbing. The days of the fumigation is gone. So no role of the fumigation of the OT. The high wall scrubbing is done. And we actually give a spray for sterilizing the anesthesia machines once the plastic cover is taken off. That's it.
Second question is, sir, is digital platform will take important role in the medical field post-corona era?
It's not the question of post-corona. Digital platform has always its positive role in whatever may be the situations in the medical science. See, now the days has come, you need to establish your treatment protocol in an evidence. Any of the patients, suppose any of the patient says, I was awake during the procedure, I was being able to listen whatever conversation was going on. Or the patient was absolutely rock stable, but some unwanted thing happens inside the operation theater. The only your record keeping, a proper record management can only tell you what actually happened, and based on this you can justify your treatment protocol and establish, because it is what evidence based. So digital, it's not, we are thinking digital because we don't want to use these paper transmissions and other things. That's why. Forget about the pre-corona or the post-corona era. Everywhere, irrespective of the corona, digital recording has its highest edge in maintaining the medical records at any point of time.
Third question is, what will be the changes take place by clinician to handle patient in ICU or in OT after this COVID period?
The practical one is COVID will not go. We have to stay with COVID. Once the lockdown and everything will over, you can see the West Bengal card. The active cases are jumping like anything, right? So you have to stay with COVID, and every alternate person will have a COVID positive. So you cannot keep yourself flying throughout the day, isn't it? You need to touch, you need to land you need to put your feet and other things. You know where the virus and other things, it will be affected. The only thing is few things practice the clinician must do at least till coming 5 years. That is the number one. Whenever you are having a little bit of suspicions, the patients can have some viral infections. Obviously, keeping the mind in the COVID and other, you need to take a proper precaution. Wearing gloves, if not possible, the wearing PP suit and other, wearing a sterile gown, and simultaneously wearing a shield, helmet shield like. These are the things is must. Next, just like a serology, what do you do for any surgical procedures? For it is become all the customary practice of the all hospitals that you need to do an hepatitis B, hepatitis C, and the HIV test to be done. Now the next fourth name come is a COVID test. So every patient should undergo COVID test. If it is negative, one channel. If it is positive, one channel. So COVID test will become a permanent thing for all the patients undergoing any type of treatment protocol. It can be a medical treatment, it can be a dialysis, surgical treatment, whatever may be. the patient has to undergo. And the next one is, there are a lot of protocols in the intensive care unit needs to be changes. We have to actually come back from the non-invasive ventilations. As you know, this high flow, what I won't be able to say, the 5 important things for any intensive care practice in a COVID situations that will last in the post era also. Number 1, we cannot go for a jet ventilation. We cannot go for a high flow nasal oxygenation. We cannot go for a BiPAP or the CPAP. This is non-invasive ventilation, because these are the very high aerosol generating procedures. So these are the things to be modified, because our ICCU ITU protocol will be modified. Our investigations, pre-operative or the pre-procedural investigations is going to change. And next, interaction of the patients, we need to take a lot of precautions before touching or before interacting with the patients. So these are the changes are must, and you have to make yourself habituated with this.
Due to time constraint, I'm just taking another one question, last question. Do you feel that doctor handling COVID suspect patients should maintain distance from their own family? Currently,
see, the question is, I already gave my answer in one of my slides, right? If you have in your family an age-old individual, suppose I am telling my story. My father is a 70 years old individual, is having hypertensive diabetic. My mother is a 67 years old lady, hypertensive, diabetic, renal failure, and on hemodialysis for 3 days a week. She will undergo dialysis today at 9 p.m. So for these individuals, we need to be a little away from them. It's better not to directly, because if you are not getting affected, but if by some way the virus is getting carried with you inside your family, and these people get affected, there is a tremendous, well-established bad outcome. So if you have a small children, health compromised people, immunocompromised people, age-old people, cardiac comorbidities, diabetic, renal failure, malignancy, it's better not to come directly, particularly the clinicians who are actually seeing the patient regular basis, because honestly, they don't know, because COVID positive or negative, now the days has gone that you can suspect, because we are getting in a line way, the young individuals, absolutely asymptomatic individuals, they are coming COVID positive. So these are the things the clinician has to keep in their mind. After all, we are all human beings.
Sir, one question I'm taking.
Yes. Shantas, your voice is not clear. Tell me once again.
Yeah, this question is from Mr. Saurav Mukherjee.
Yes.
In sample categories, blood sample
Yes.
or urine sample has to be present. Asking the question.
See, actually your voice was not clear, but if I can understand, you are telling whether the urine sample is contaminated for this or not, is it?
Yes, sir.
Yeah.
Yes, sir.
See, till now, all the aerosol procedures, that is any secretion from the respiratory tract is contaminated. A new paper has come that semen also getting contaminated with carrying the coronavirus. But right now, urine and the blood, the contamination is a little bit of query. They don't have proper answer whether the urine is carrying the contamination things or not. But for an universal precaution regarding all the sample thing is concerned, we must take it as an assume, just like an emergency case. Yes, urine can also has a chance of contaminating or carrying the virus.
Great, sir. So with this question, we'll close this part of the session.
Okay.
From from audience and from the team of Mindray India, I'll thank you for this time given for this particular great topic.
No, I understand.
So, thank you so much, sir, for this lovely presentation and your time.
Thank you, Shantas. Thank you very much.
I'll request Mr. Santosh Verma to start the next session.
Sir has to stop sharing the screen.
Sir, you can stop sharing the screen, sir. Or Surajit, you
Yeah.
can stop. Oh, yeah, you can stop.
Stop.
Yeah, thank you, sir. Vermaji, you can yeah, share your screen.
Is that visible?
No, not yet. You just share your screen. Share your screen and then select the PPT. Yeah, it's coming.
Now it is visible?
Yeah, make it a full screen.
Yeah.
Yes. Yes.
Yes, sir. Please go ahead.
So thank you, Dr. Sarkar. Really,
Yeah,
it
it's
was
visible.
very
Yes, it's
useful
visible.
information for all of us. So once again, very good evening to all the audience here. And I once again gave warm welcome to, on behalf of whole Mindray team, to all the audience, all our unsung warriors who are present in this webinar. Basically, I will, because of the constraint of time, I will cover a little quickly. The topic from my side is that personal protective equipment wearing guide. Basically, at this time of pandemic, we are considering only for that related to the COVID-19 or Corona COVID-2. There are so many PPE used for industry wherever people are working, or some industries are very much specific. We will not go for that. Let's go quickly because time is very short right now. We will try to cover these things which are related to the COVID-19. Basically, if you see this table, we are having 6-7 types of PPE to cover different parts of the body. So the first one is the mouth, head, body, hand, eye, and feet. So there are 2 types of area in most of the healthcare departments or healthcare hospitals. The one is the low risk and high risk area. So in the low risk, it is categorized like general wards, surgery, pre-test triage. Surgery you can't put in the low risk. It is also coming under the high risk. Then fever clinic, general body laboratory means IVD. And then high risk is once you know that it's a particular suspected ward or known positive isolation ward for the COVID. So these kind of PPEs are put on as per this guidelines or list. The first one is the surgical mask that is mandatory for everywhere, wherever you are going inside the hospital. And you being the healthcare supporting people like BME and other staff. So definitely they are having a lot of touch and interaction with the medical equipments. So the surgery portion is recommended that surgical mask, protective cap, head cap. Then this single-use anti-seepage gown, this is optional, but you can, for the precaution, you can put on. Then protection gloves and goggle. Goggle is a seepage-proof goggle. Then protection shoe cover. Normally, these are the long height shoe covers, long length shoe covers. So let's come to the point that COVID suspected ward. Here you require, in place of surgical mask, normal surgical mask, you are supposed to put on that surgical N95 respirator. Then protective cap for the head and hairs, because hairs are also very much prone to catch a virus. Then coverall as Dr. Sarkar has already shown you, that's a whole body covering GSM 90 plus above material cloths, which are covering the whole body, including your hood and head. Then you need to require to use the protection gloves. Double gloves are there, one single and inner side and outer side. Then this is a seepage-proof goggle. So this goggle is having depth inside. You can put normal your spectacles and other goggles, eyesight goggles also. But this one is the this is required very much because it's a seepage proof. If you are thinking that just putting on your eyesight goggles you can protect, no, it's not possible. It should be seepage proof. And then protection shoe covers. So these things are very much essential. Similarly, if somebody is going to the IVD laboratory or general IVD suspected cases are there, the same kind of PPE is required. to be put on if you are touching the IVD machines or pathological machines. So these are the different kinds of their brands, their quality control is there. Like for surgical mask, this is recommended like European Union MDD Directive 93/42 EEC, and category 3rd or EN 14683 type 2 IR and second IR. So these kind of things are very much categorized, and those are written over the packing boxes. And once you are in the hospital, you can verify with your department from where these are issued, or normally purchase department is having all this kind of information. So these are very much, these are the quality control which you can recheck. Then surgical respirator. This is N95 mask. There are certain classifications given in this list. Those who are interested, we will share that this tabular summary to all of you. So that's self-understood. The most important when you are putting on or donning means wearing these kind of PPE. So the most important is that that you make sure that whatever PPE you have taken, that is not having any kind of leakage, or that that packing is not torn out, and the bearing should be at the area where it is already disinfected. It should not be in the area where you are having any doubt or any suspect. So it is supposed to be that new PPE is having no virus, or it's a virus free. But when you are putting on, the area should also be the virus free. And putting off or doffing is a very important part of the PPE. And especially when you are in this red color area, so the guidelines are there. Whenever you are putting off, first of all, you have to wash the hands again and again, because when you have gone inside and touching the equipments, or just like a biomedical, you have gone to inside the isolation ward. When you are coming out, there are chances on every PPE outer surface may or may not be having the virus. So in that side, whenever you are touching any outer surface, chances are there virus might be there. So in that scenario, every time whenever you are putting off or doffing, you have to rub the hands, or you have to clean the hands through sanitizer, different kind of sanitizer we will discuss. So remove the goggles face after rubbing that, because this goggle is put over the hood of the coverall. So first of all, that you have to remove. Then we will come to the next slides. So all the pictures are there, how we have to doffing off. So thumb rule is that wear the mask first and take it off last. And every time whenever you are doffing off, because that is more dangerous, doffing off any PPE, for every step you have to clean your hands, either through the soap solution, recommended soap solution, or different kind of disinfectants are there. So these things already Dr. Shubhendra Sarkar has covered all. There are some 7 steps when you are washing your hands. You go through those pictures. Like first you have to rub the palms, and then making the cross fingers. That soap solution should go there also. And then putting hands over the hands. Then the last one is at the wrist side, at least 2 to 3 inch, you should clean that 3-4 inch over the wrist also towards the elbow. And what are the infectants are there that we will cover here. These are the recommended ones. The alcohol compound hand sanitizers greater than 60%, but in India it is 70% or 75% alcohol. Then Lodophor solution with an effective iodine contents of 5000 mg per liter. Then third one is the 75% ethanol solution and 70% isopropanol solution. And the last one, if you see here, that chlorohexidine is not effective. That is, if somewhere you are reading this chlorohexidine, please do not depend on that. This is not effective, checked by so many doctors and so many pathologists in this regard.
Parmaji, 5 more minutes to go.
Yeah. So this putting on these masks is not a big thing. You people are already regularly doing. we will come to the coverall quickly. See, the covering of the hairs is mandatory for gents and lady. If ladies are having buns or something, that should be covered fully. It should not be out over the coverall cloth. So let me come to the coverall. So before putting on any coverall, you have to check whether somewhere it is having any leakage or any kind of turn off or something is there. Then the coverall is beard at some very infected clean area. Maybe you can put some sheets of plastic sheet or maybe some sheet cover, which is disinfected by the disinfectant like chlorine or some other solutions. And then you should put from feet side to the hood side, bottom to top. And once you have put on the coverall, then this seepage proof goggle is put on over the head. And this inside you can put different kind of eyesight goggles also, that is possible. And this is a totally seepage proof. So when you are doffing off, this is the procedure. Like the outer surface of any coverall is having chances of virus. So this doping off is done that like you are rolling out from hood to bottom side, and the inner surface is coming above of that. Then at some designated area or some disposable boxes inside the hospital where it is identified that COVID-19 or isolation bars are there, then you have to put into the designated areas. And because goggle or seepage proof goggles are having shortage, that you can reuse, but not immediately. At least for 25 to 30 minutes, you have to put inside some solution, maybe chlorine disinfectant or certain solutions are recommended for that. So inside that you have to put at least 25 to 30 minutes. Gown is normal. We people are using in cath lab and so many other places, but nowadays those days are gone, as shared by Dr. Sarkar. We have to be very careful. Whenever a suspicion is there, then we should put on the complete body coverall. Shoe covers you have seen in the picture. These are some long shoe cover. Those are required. Those are put over the trouser and whatever body cover or coverall portion is there. So how to remove those things? How long you can use the mask? So as per from engineering side or our HQ side, recommendations are that whenever you are inside working over some machines, you should not use any mask, whether it's N95 or other masks, more than 4 hours. And there are, whenever you are doing any activity, whether you are taking water or some food, and you have to change every time this mask. And hand sanitizing is must for that. So because of shortage of time, I think that's all from my side. If you have any question, like Dr. Sarkar has already shared, this is the actual picture which has been taken by our doctor in China, Dr. Ramon Simon Lopez. And this is the electronic microscope picture. The size of the virus is, you can see here, it is 100 nanometer, or you can say 0.1 micron. So very, very small, unseen enemy. As sir has already shared, most of the problems are curable. 81% people are curable, and 14% is having some moderate problem related to the respiration. Then 5% used to come into the critical condition where ventilator is to be used. So quickly, I am finishing these slides. These are some slides from Dr. Dhruva Reddy. Gurba Reddy from, he is a very big, he is a very well-renowned in Southern India knee and hip replacement surgeon. So he has shared very big, because at this point of time, we are surely facing a lot of mental trauma and all things. So he has shared certain positive attitude pictures in one of the webinar. So I took the pictures of that. So negative mind will never give you a positive life. That is the quote given by Dr. Gurva Reddy on that day. Then another is the ego. ego is inversely proportional to knowledge. If people are having better knowledge, definitely the ego should not be there. Then he has given some mantra to how to live happy and in this kind of pandemic time. And last one was very beautiful from his side, that life is beautiful for who can feel it. So thank you very much. That's all from my side. I wish all of you all are doing wonderful job as a unsung warriors toward this COVID-19 fight. So wish you all the best and good luck from my side and from whole Mindray team. Thank you. Thank you very much.
Thank you, sir. You can stop the screen sharing, and then I'll request Mr. Rajesh Gupta to start the presentation. Gupta ji, yeah, you can share the presentation. Maximize it. Thank you. Please go ahead.
Yeah, good evening all. Thanks to Dr. Kar and Verma for giving us insight about all this. So today I'm going to take care of this do's and don't for this biomedical, non-paramedical staff, and even doctors are taking care of the anesthesia machine, ventilator, monitor, and ultrasound. So it is very important to know from the perspective of the service provider and the perspective from this organization who is manufacturing the equipment to take care of this. So the purpose of this to ensure the safety of biomedical engineer or who are handling the machines and avoid the exposure and minimize the infection. So based on this criteria, we are going to discuss a couple of things to take care from the recommendation point of view. It is necessarily in this lockdown and the pandemic, all our engineers, biomedical and the technical staff, paramedical staff is doing all the jobs required to take care of the patient, COVID-19 patient, and support to the doctors. So at the same time, it is recommended to have the PPE the standardized as per the low risk area or the high risk area, or follow the hospital protocol. And at this time, somebody has also asked the question, what is the digital future of post-COVID? Yes, of course, digital is going to be a post-COVID. We all are engaged through the technology. We engage through the non-face-to-face technical training. Today, we have the great experience doing the installation remotely supported by our engineer, and one hospital staff has done the installation of the ventilators. So this is the future of the. So we do recommend you to start the non-face-to-face end user training whenever you are conducting from the biomedical department, from the conference room, and let the user who all are in the ICU and other wards take care of patient. So live broadcast and the other things are also available in this. So at the same time, always follow the service manual and the recommendation what we done by the as a manufacturer recommendation. And in the response of the global outbreak, the COVID-19, Mindray and other OEM also reinforcing the cleaning, disinfection, and sterilization solution. Please refer those for especially designed for the COVID-19. We do recommend, and we are going to share all these documents to the participant. So here is some recommendation how to start with the job. Protection and precautions, maintenance and the repair procedure. If you are taking care, this is perspective of the medical equipment repair and the maintenance, how we are going to take care of the PPE we have to do. Sometimes there is two conditions. One is the designated COVID hospital and is the non-COVID hospital. So here repair area recommendation set up the independent maintenance area, device isolation. So device isolation is very important. You don't do the mix and match with the other equipments in the department. And if it's non-COVID, there's no need to isolate the isolation of the equipment. Repair area, yes, always you need to disinfect with the 75% alcohol spray or recommended with the required tools. Sometimes what we go unknowingly and knowingly, we are taking care of complete tools inside don't expose all other tools to this machine, this COVID-19 area. So only need to use the tools which is required. Spare parts, sometimes spare parts are coming, some accessories are also coming, some patient tubings are also coming, SpO2, ECG, and that ultrasound probes are coming. So you do need to take care of all these things with a 75% alcohol spray and some isolation also. And hand hygiene after all this maintenance, yes, it is very mandatory, like what we have seen for the PPE recommendation. So these are the basic, and we need to do how we are going to protect all these our equipment. Sometimes some accessories which can be the water resistance, that can be soaked into the chlorine disinfectant. And then here we have sometimes some device associated infections also in this area. So before I start any recommendation maintenance on the machine or use of the machine, anesthesia, ventilators, monitors, we need to use this ether at the 75% ethanol effective inactive. What we have measured from this our guideline, it has observed that at the temperature of 76 degree and for the 30 minutes, if you are going to ultraviolet exposure also, so this are going to be a little bit of inactive of the virus. At the same time, here is the recommendation based on the temperature. If you have the surrounding area temperature 20, so it is recommended for the 30 minutes disinfectant. If we have the temperature higher side, so so based on the humidity, if humidity is less below 60, then it is 30 minutes. If humidity is more humid area, and then we need to use for 90 minutes. So here is the recommended, the main factors. So here the main factor, one is the 1, 2, 3. So aerosol, and then we need going for the device associated, which basically we are talking about now. Our people are also in the field and doing with the full PPE and the protection. So here we are using that HEPA filter, which is one line of protection from the external things going to the patient. And then here we have the some cleaning and the disinfection protocol. So that is here recommended. So here we have this cleaning, basically all with the detergent soap with the pH 7 to 10 and alcohol solution, then wipe this remaining of the cloth. And then we can use with this all recommended appropriate for the 3 minutes. And the water temperature is recommended for the 40 degrees centigrade, and any detergent soap water can help here. And at the time of disinfect, this is recommended for the autoclave, the 134 degree autoclave for the 10 to 20 minutes. All it is recommended for the breathing area, non-breathing area, inspiratory, expiratory, all the other recommended part of the inspiratory module, circuit, breathing circuit, sometimes soda lamp canister and jar. So it's a level of exposure to the machine, to the ventilator, to the anesthesia machine. We do recommend for the 134 degrees centigrade autoclave. That autoclave must have the high speed destabilization. So the pre-wake cycle has been done, and the 7-minute exposure to the steam will kill this kind of virus and the bacteria. And here is some recommendation of cleaning. The clean one, the cleaning process, the simple water, soap water with this 7% of pH value, and ethanol 75% for all the anesthesia machine, and the sodium hypochlorite bleach is the good disinfectant. The 10% is the concentration for all the other machines. So here we have other things, isoprof. So basically in India, we mostly use with this sodium hypochlorite bleach with the concentration of this 10%. And isopropyl is the 70% with the disinfectant is available. But this recommendation is only for this COVID-19 era. Later part of the things we need to take care of as normal maintenance and recommendation of the manufacturer. Sometimes here we have the patient monitoring. Yes, the same kind of things is going through the same set of cleaning and disinfectant recommended for the patient monitor and all this. So here just simple inspiratory and expiratory, just we take it out and we can clean it, and then you can do the disinfectant or autoclave. Here we can use the first line of and second line of protection. You can also use, sir has already told me the why we can use the HME filter to prevent that heat and moisture exchange. But at the same time, we do recommend one external safety of the devices can be used, one external filter, the viral filter at the expiratory folds. That's the second level of protection of the machine from this getting contaminated. So apart from that, here the ultrasound is also vital role in this COVID-19 situation, where this is recommended for the all COVID-19 patient to do the diagnostic. So here is the same level of protection and same all recommendation what we have. The 2.5% glutathione is the high level of disinfectant. Low level disinfectant is already there, the ammonia wipes, and then we can also sterilize with the hydrogen peroxide 0.5%, and then this is not recommended. The probes is not recommendation to kill in with any alcohol-based spray. This need to be taken very seriously. No transducer should be wiped by any of the alcohol-based spray and the disinfected solution. So this is the protection of the ultrasound machine and the probe also. So that's all about do's and don't about the maintenance and the equipments and the protection to the biomedical engineer and the paramedical staff. So thank you.
Thank you, Gupta ji, for this lovely presentation. And with this, we are ending our session. We have another, separate webinar. So we need to close the session now. Thank you. Thanks all for this participation. Thanks all.
Thank you all.